Our health is our lifetime's work. It is the most important project we'll ever do, isn't it? When we're born, we get this random assortment of stuff. We get, eyes and bones and blood and guts and all sorts of things. And it's our awesome responsibility to turn that into the best human machine that we possibly can. We're going to need support, and we're going to need the information and the instruction manual, aren't we, to go with it. As a patient, I think the average patient can spend something like 2 hours a year in front of a clinician. I mean, I'm a bit of a chronic case, so let's say I spend 24 hours a year in front of one clinician or another. That's still 364 days of the year that I'm home alone. And that's when all the important health decisions get made. It happens when I'm deciding whether to have a glass of wine or a cup of tea, go up the stairs, take the lift, go out and exercise, don't. That's when I need information to enable me to make the best possible fist of those health decisions I make to improve my health outcomes. I'm at Horton Thornley Medical Centre, who provide me with the most fantastic set of resources for information and help. The first thing is we have a terrific website. Patients and families have been able to have access to their online GP records I've had access to mine since 2006. Remember, I can take all my information, all my GP information with me everywhere I go, at home and abroad, with just 2 passwords. It gives me great confidence in my situation wherever I am. It also gives me a tremendous amount of independence and a tremendous amount of security. When I click onto my records, I get a summary. The summary gives me an opportunity to choose current problems, current medication, recent consultations, test results, recent letters, allergies and immunisations. So if I was to choose summary, then I would get a record of my current problems, a list of my significant events. As you can imagine, this is invaluable for when I have to tell my story again and again and again. I have monthly blood tests. I'm on immunosuppressants. The doctor will put a comment on when it's up there, so it might say, high but getting better or something like that. I know the doctor's seen it. I know they'll get in touch with me if there's anything that needs to happen. But if there isn't anything that needs to happen, they don't need to contact me, and I don't need to contact them. I can see any letter that has gone out of the practice or comes into the practice that's related to me. Now that's absolutely great, because if somebody says I'll refer you for something, well, I know they have, because I can see that it's gone. Last week I was at cardiology, and the cardiologist said that my notes had turned up, only that big and not that big, and there was a big chunk of stuff missing, and there was some information he needed. So I got out my mobile phone and I showed him the information on my mobile phone. I can look at records of consultations that I've had with my GP. That's absolutely terrific. This is about safe medicine. If clinicians are sending people out of their offices or their consulting rooms knowing that people are only going to retain 10%, then it may be a good idea to support those patients by allowing them to read a record of the consultation, so that I can look at it afterwards. I can make sure I understand what's happened. I can make sure I understand what medication I'm supposed to be taking, what my role is in what happens next, and what the doctor's going to do next. Every time I go online to look at my blood test results and don't have to ring the practice to see if they're there, and all the time I'm doing all these things myself online, I'm not contacting the practice. To me, empowering patients and giving them control over their situation so that they understand when they're making all these hundreds of health choices that they make every day, to me, giving people that information and allowing them to make a good fist of the most important project in their life, to me, that's a no-brainer. So I can't see how you can argue it the other way around, that patients are going to thrive in an environment where they're not allowed information and where they're not given support. If we think of ourselves as a team, rather than you doing stuff to us, I think, you know, that's where the exciting progress is, and I think patients are the biggest underused resource in the NHS, actually. I'm sure other people have said that too. Okay, thanks.
Thanks very much.